The collapse in the labor market isn't being hidden, it's just being ignored. And it's the most difficult to ignore in the healthcare sector. Here's a report from NBC News as an example that says Omicron is creating a crisis, a red tier situation in healthcare. Almost 1 in 5 healthcare workers have quit their jobs since February 2020, but on top of that, they're out sick with COVID. Here's a report from earlier in the week from Como News that says nearly 1/4 of U.S. hospitals are reporting staff shortage. So 25% of the hospitals across the United States are in some kind of shortage. There have been a wave of emergency declarations from Virginia to Maryland to Illinois. Looking to Colorado, Colorado's had such a shortage of workers that they have reactivated their crisis standards of care, shifting how they're going to apply triage standards for emergency care. Under this guidance, EMS personnel are stopping life-saving measures in patients with out-of-hospital cardiac arrest. And even the most severe cases, they're the only ones that are even being taken to the hospital. They even mention in their script for personnel that emergent transport by ambulance to the emergency department likely outweighs the benefits. In other words, don't come to the ER. It's not worth it to come here. And in this news article from WLOX, Mississippi has also returned back to the COVID health plan, back to their crisis standard of care, because they've got limited ICU availability. The state's only level 1 trauma center is being forced not to use 55 beds because they don't have the staff to manage the care for those beds. Now let us look at a video on Instagram that The Daily Show highlighted where a nurse is talking about this.
Well, guess what? We're running short on a nurse, so you're going to take another 1, 2, 3 patients. And right now in the COVID area, we're seeing that in the ICU. I've never heard of that in the ICU in 25 years of nursing.
The most obvious way you can see the collapse in the healthcare labor market is that several hospitals have started to ask asymptomatic staff to work. That is, people who are known to have been infected with COVID, who are in direct healthcare positions, have been asked to stay on the job. Here's an example from NBC News out of Rhode Island. The article specifically says the decision to utilize COVID positive staff who are asymptomatic is consistent with CDC guidance that allows hospitals facing significant staffing challenges to utilize asymptomatic or mildly symptomatic workers. This means even the CDC knows that the hospital labor market is on the verge of collapse. This is not unique to Rhode Island. Let's look at California. Here's Eyewitness News ABC 7 from about 4 days ago, where California says, yes, asymptomatic healthcare workers with COVID don't have to test negative or isolate to work. The article does go on to note that these providers that come in have to wear N95 masks at all times, and they should only be interacting with patients who have already tested positive, quote, to the extent possible. In other words, it's a guideline, it's not a requirement. Theoretically, this means that nurses in California can test positive for COVID, slap on a mask, and walk right down the hall and start treating patients. The California Nurses Association, according to the article, believes that this change will put patients and hospital staff at risk. Here's another article from ABC News from earlier in the week that goes on to say that this is happening in other parts of the country. This is crushing the labor market in other areas. Now, I do expect this is going to be a short-term wave in the labor market, but it's going to have repercussions on our quality of life and our GDP. So let's look at some of those examples. Here's an earlier article from AP News. They talk about ambulances in Kansas City having shortages, trash pickup and subway services are seeing employee outages and shortages in New York. And it's also diminishing the ranks of firefighters and emergency services. Security checkpoints are being shut down at the largest terminal in Phoenix. And they touch on a little bit about how the schools are struggling to find teachers for their classrooms. In Connecticut, so many teachers have been out that administrators are now stepping in to cover classrooms and teach. Here's an article from Vox where they go on to explain that America doesn't have enough teachers to keep schools open, and this problem started before the Omicron. They go on to talk about schools going remote in Ohio and Maryland and Pennsylvania and New Jersey. It's not just Chicago that's suffering this problem. It has started to become a nationwide problem. Here's an article from Supply Chain Brain that talks about how not only truck drivers are quitting, but seafarers are quitting. The seafarers have been stuck on ships for months, and they got home and got shore leave for the holidays, and they're not going back. They go on to note that in Singapore, they've got a tanker operator that says about 20% of its 1,000 mariners don't want to get back on the ships. Another company says 5% of their 30,000 mariners indicated back in November they're not interested in getting a new contract. And so that's going to make shipping costs go up even more. And it's in other areas of transit as well. Delta says 8,000 employees have contracted COVID over the last 4 weeks. They've lost $408 million. They're not even profitable right now. This spike is also affecting food outages. There are food outages in grocery stores. And finally, here's an article from USA Today that's actually posted on Yahoo Sports for some reason, but it goes around and it shows, and this is from January 11th, just 3 days ago, how many stores across the country are having these shortages of food. About 15, it goes on to note that about 15% of the brands are out of stock. The article says that U.S. groceries typically have 5 to 10% of their items out of stock at any given time. And right now, that's hovering around 15%. Now, I think all of this is temporary, but the reality is it's going to impact our supply chain, and it's temporary disruption that foreruns the disruption that we're going to see from China. And this is going to cause a drag on the economy for Q1 of 2022. Tell me in the comments below what you think is going to happen next in the economic circus.